This podcast is brought to you by The Senior Techie, a source of information for seniors and others about technology. Welcome to The Senior Techie Podcast. We are so glad you can join us today.
Absolutely.
If you are 55 or older, or if you're simply looking out for someone who is, you are definitely in the right place. Today, we are looking at how modern technology is quietly revolutionizing hearing health. And I mean revolutionizing it in ways that make it far more accessible, incredibly affordable, and, honestly, practically invisible in some cases.
It really is a completely new landscape out there.
Yeah.
We look at the mechanics of what these devices can do today compared to even just 5 years ago. The leap in audio processing and miniaturization is staggering.
Yeah.
The options available to you right now would have seemed like science fiction just a decade ago.
They really would have. To kick things off, though, I think we need to look at the sheer scale of the issue. According to the research we are looking at from the Senior Techie, over 80% of people who need ear and hearing care never receive it.
It's a massive number.
Let that sink in for a second. Over 80%. It is basically a healthcare crisis hiding in plain sight.
It absolutely is. And if we connect this to the bigger picture, especially for seniors, it becomes clear why that 80% statistic is so alarming. Hearing loss is, well, it's incredibly insidious. It's not like waking up one day with a broken arm where the problem is obvious.
Right, you know immediately that you need help for a broken arm.
Precisely. But hearing loss sneaks up on you very gradually. At first, it is so easy to brush off. You might blame the acoustics in a noisy restaurant or think to yourself that your grandchild is just an incredibly soft-spoken person.
Oh, right, it's always the environment's fault or someone else is mumbling. But the source material points out that when you leave that gradual hearing loss untreated, it triggers a real domino effect.
Spot on. The medical community has drawn heavy links between untreated hearing loss and social isolation, cognitive decline, and just an overall reduced quality of life. Think about it from a neurological perspective. When you cannot hear well, your brain has to devote an enormous amount of energy just to decode the muffled sounds you are taking in. We call this cognitive load.
So it's literally exhausting your brain.
Yes, because your brain is working overtime just to figure out the words, it has fewer resources left over for memory and comprehension. Over time, you start pulling back from conversations. You stop going to busy family gatherings because it is just too exhausting to keep up.
Yeah.
Your brain actively receives less stimulation.
So what does this all mean for you, the listener? Our mission for this podcast is to walk you through a complete spectrum of practical, affordable tools that are available to you right now. We are going to explore the capability tiers of everything from free phone apps you can download in seconds.
Which are fantastic, by the way.
Yeah, amazing tools. From those apps to localized television audio systems to the new world of over-the-counter hearing aids, we want to ensure that you have the knowledge to never miss out on the conversation again.
The goal here is to demystify the hardware and the software entirely. You do not need to be intimidated by the technology, and you certainly do not need to resign yourself to just smiling and nodding when you cannot decipher what someone across the table is saying.
Let's start with the easiest, most actionable step you can take. Before you spend a single dime, before you even think about booking a doctor's appointment or driving across town, you can actually test your hearing right at home.
Which is usually the biggest hurdle for people,
Yeah.
just figuring out where their baseline is without feeling the pressure of sitting in a clinical waiting room.
The information provided by the Senior Techie points out a free app called the Mini Hearing Test. It is available for the iPhone, and it's consistently rated as one of the best accessible options out there.
Yeah, it's very highly regarded.
What makes it particularly useful is that it takes just a few minutes, and there's absolutely no email sign-up required. Plus, it saves your results right on your device so you can track any changes over time. But I am curious, how much can we really trust a phone app? Is this actually meant to replace going to an audiologist?
That is a crucial distinction to make. No, it absolutely does not replace a clinical exam by a medical professional. You aren't sitting in a calibrated soundproof booth. However, what's fascinating here is the underlying science the app uses.
Okay, how so?
The Mimi app conducts a pure tone threshold test. It plays sounds at varying frequencies. Think of it like testing the high, middle, and low notes on a piano, and it measures the softest volume you can hear at each of those pitches.
Ah, I see.
It creates a detailed breakdown, which acts as a simplified version of the audiogram map a doctor would create. So, while it isn't a medical diagnosis, it is the absolute perfect diagnostic starting line. It gives you concrete data to decide if a follow-up with a professional makes sense.
And if you are an Android user, you are not being left out. The senior techie notes that Android users should keep an eye out for a free app called WEars. It is being released by the World Health Organization specifically for community hearing screening,
Bringing that screening process directly to the device you already have in your pocket.
using the headphones you already own.
Right. It removes a
Yeah.
massive amount of friction.
So let's say you take that test in a quiet room, look at the results, and realize you could actually use a little help. In 2022, the FDA made a massive regulatory shift.
A huge shift.
They ruled to allow over-the-counter hearing aids, or OTCs, in the United States for adults with mild to moderate hearing loss. You no longer need a doctor's visit or an expensive prescription to get started.
This shift cannot be overstated. It disrupted the entire industry model and broke down the barriers of cost and access for millions of people overnight. But we should clarify what mild to moderate actually means here.
Right, because it's not for everyone.
Correct. It generally means you might have trouble hearing someone whisper, or you struggle to follow a conversation in a noisy room, but you do not have trouble hearing loud sounds. If you cannot hear a loud vacuum cleaner or a dog barking, your hearing loss is likely severe and you still need the traditional medical route.
That is really helpful context. Now, let's look at the hardware itself. We want to be clear that we are simply reporting on the options highlighted in our sources, not taking sides or endorsing specific brands. But the senior techie says MD Hearing is a highly recognized name you should know about in this new OTC category.
Yes, you can find their lineup at mdhearingaid.com.
They are favored by the National Council on Aging, or NCOA, for being secure, comfortable, and discreet. Rather than getting bogged down in every single detail, let's look at the capability tiers they offer.
Breaking it down by tier is definitely the best way to understand the value. What does their entry-level tier look like?
Their entry-level option is the MD Hearing Air. It is a behind-the-ear style. It goes for $297 a pair, and what stands out is that it is completely rechargeable with advanced noise reduction.
The rechargeable aspect is a massive quality of life improvement. For a long time, hearing aids relied on tiny, disposable zinc air batteries.
Oh, the really small ones.
Yes. If you have any issues with arthritis or fine motor skills, changing those tiny batteries every few days was a nightmare. A rechargeable system you just drop into a dock at night is a game changer. And the noise reduction is vital for environments with a lot of background chatter.
Then, stepping up to their mid-tier, they offer the NEO and the EO XS models. These range from $297 to $397 a pair. They are compact, in-ear designs giving you an 18-hour battery life and 4 selectable listening environments.
That's plenty of power to get through the day.
Definitely. Moving up to their premium tier, there is the NEO XS PRO at $597 a pair. It is their smallest model and boasts excellent noise and feedback reduction.
Feedback cancellation is fascinating technology. Have you ever heard that awful high-pitched whistling sound when someone hugs a person wearing a hearing aid?
Yes, it's terrible.
That happens when the amplified sound leaks out of the ear canal and goes right back into the microphone, creating a loop. Devices with advanced feedback reduction use phase inversion. They detect that whistle and instantly play the exact opposite sound wave to cancel it out before you even hear it.
That is incredible that it is happening in real time inside such a tiny device. But this raises a question about modern connectivity. Most of us are listening to things, taking phone calls, watching videos on our phones. How do these OTC devices handle that?
That is a vital question, and it is a common caveat with over-the-counter options. Most of the MD Hearing models lack Bluetooth audio streaming. They're strictly for amplifying the world around you.
So the guide points out that if piping your phone's audio directly into your hearing aids is a priority, you have to look at their Volt Max 2 model. It's also $597 a pair, behind-the-ear style, but it is the only model in their lineup with smartphone app compatibility.
Then this brings up the immense benefit of these OTC options. You are getting advanced tech like feedback cancellation and smartphone compatibility at a fraction of the historical cost. Plus, MD Hearing specifically offers free lifetime audiologist support. You have professionals available to help you remotely.
MD Hearing is a strong option, but the senior techie strongly emphasizes that there are other notable contenders.
Absolutely.
For example, the Jabra Enhanced Select 700. The National Council on Aging highlighted this one as their best overall over-the-counter pick. It includes 3 years of remote professional care, and it supports the new LE Audio Bluetooth standard.
LE Audio is a fantastic development. LE stands for low energy. Traditional Bluetooth drains tiny hearing aid batteries very quickly. LE Audio uses a new codec that provides high-quality sound while using barely any power. It also offers much lower latency, meaning there is less delay between seeing a video on your screen and hearing the audio. It is heavily optimized for hands-free calling.
Then there's Eargo, offering models like the Eargo 8, the SE, and the Eling-NK. These are tiny devices that sit completely inside the ear canal for seniors who want absolute discretion.
For people who just do not want anyone to know they are wearing a device.
Precisely. It's a marvel of miniaturized engineering. The Eargo 8 even adapts automatically to different acoustic environments as you move through your day. And for those who are a bit more tech-savvy, the guide mentions the Lexi B2 powered by Bose.
Oh, that's a great one for value.
You get 10 personalized sound settings, 4 presets, lifetime audiology support, and a 1-year warranty. It is perfect for people who love to tinker with an app to self-tune their perfect sound profile.
It is empowering to have that level of control over your own medical device. But what if a listener has hearing loss that falls into that severe category, or they simply prefer the traditional in-person medical experience?
That is an excellent point. If you want prescription-grade options without paying traditional clinic prices, you need to pay very close attention to this next part, especially if you have a Costco membership. The numbers we are looking at are just wild.
The Costco Hearing Center is arguably one of the most disruptive forces in senior healthcare right now.
According to the Senior Techie, traditional audiology clinics typically charge between $3,500 to $4,500 for prescription hearing aids. But the prescription models at Costco range from just $1,499 to $1,699.
If we look at the math, that represents a staggering 65% savings. And you are getting top-tier prescription-grade technology. But the benefit to seniors goes far beyond the initial sticker price.
What else do they get?
By going the prescription route at Costco, you are getting an in-person fitting by a licensed hearing specialist. They perform what are called real ear measurements, where they place a tiny microphone inside your ear canal along with the hearing aid to measure exactly how the sound is bouncing off your specific eardrum.
So it's completely tailored to you.
Yes, it is highly customized. You also get unlimited free follow-up appointments, which is vital as your brain requires weeks to adjust to processing high-frequency sounds again. And perhaps most importantly, they offer a 6-month return policy that takes almost all the financial anxiety out of the process.
That peace of mind is huge. Costco currently carries 4 main premium brands: Philips HearLink, Jabra Enhance Pro 30, Rexton Reach, and Sennheiser Sonite R.
Out of that lineup, the Jabra Enhance Pro 30 really stands out for its connectivity. It offers excellent iPhone and Android streaming, plus hands-free calling, all included in that deeply discounted price.
Now wait, if you are a longtime Costco shopper, you might be wondering about their famous in-house brand. Didn't they used to sell Kirkland's signature hearing aids?
They did, but the Senior Techie notes that Costco actually discontinued their Kirkland's signature house brand back in 2022.
Which sounds bad at first.
It does, but it is actually a massive positive for the consumer. Instead of pushing a single budget house brand that might not be the right acoustic fit for your specific hearing loss, Costco now focuses entirely on offering premium name brand technology from leading global manufacturers at those highly reduced warehouse prices.
That makes a lot of sense. Now, it is one thing to navigate a noisy coffee shop or a clinic with these new devices, but often the most frustrating hearing challenges happen right in the comfort of our own homes. Let's talk about the living room.
The living room is a major battleground.
It really is. Picture this relatable scenario. You are sitting there trying to watch a quiet British mystery show. You want to follow the dialogue, but to you it sounds like the actors are whispering. Your spouse is sitting on the couch trying to read a book, and to them, the TV is blaring. It turns into the daily TV volume wars.
It is one of the most common and, frankly, most frustrating daily experiences for seniors with hearing loss. It creates unnecessary tension in the house, and quite often, the person with hearing loss simply gives up, stops watching, and isolates themselves.
But the Senior Techie strongly emphasizes that you do not have to just sit there in silence. There are brilliant technological solutions specifically designed for this. First up, RF wireless headphones. RF stands for radio frequency. The source material points out that RF systems are vastly superior to standard Bluetooth for watching television. Why is that?
It comes down to how the signal is transmitted. Bluetooth has to compress the audio data, send it through the air in packets, and then your headphones have to decompress it.
Which takes a little bit of time.
Exactly. I mean, spot on. That processing takes a few milliseconds. When you are listening to a podcast, you do not notice it. But when you are watching TV, a split-second delay means the actor's lips move and the sound arrives a moment later. We call that lip sync delay or latency, and it will drive you crazy.
I hate when that happens.
RF technology operates on a different frequency band that has extremely low latency. The sound perfectly matches the picture. Plus, RF signals can pass through walls much easier than Bluetooth, meaning you can walk to the kitchen to grab a cup of coffee and still hear the news broadcast perfectly.
That's brilliant. But what if you find wearing over-the-ear headphones for hours to be uncomfortable? There are amazing localized room audio solutions, too. Take the Simolio SM621D. It is a wireless speaker that uses built-in hearing aid technology, and you just place it right next to your chair on an end table.
So the sound is right there with you.
Right. It clarifies the dialogue right next to you without blasting the rest of the room. Then there's the chair speaker CS3. This is a near-ear design that literally clips directly to the headrest of your recliner. The sound is directed right at your ears from just inches away.
Those localized speakers are wonderful because they allow you to maintain an awareness of the room. If your spouse asks you a question, your ears aren't completely covered by heavy headphone cups.
And if you want a solution that works for everyone in the room, the guide highlights ZVOX soundbars. They have a feature called Dialogue Boost. This is fascinating because instead of just making the entire movie louder, which just makes the explosions and background music deafening, it specifically targets human speech.
Which operates on a very specific frequency.
Precisely. Human voices generally fall into a specific frequency range, usually between 2,000 and 4,000 hertz. The ZVOX acts almost like a smart graphic equalizer. It pulls out those specific vocal frequencies and amplifies them, lifting the dialogue out of the muddy background noise.
It is a perfect example of technology solving a very specific, nuanced problem without just throwing more volume at it.
We have covered a massive amount of hardware, but I want to leave you with a tip that requires no new hardware at all. Your smartphone, the device you likely have sitting right next to you, has hidden superpowers.
Oh, the smartphones are incredible now.
There are life-changing accessibility features built right into the operating system, and they take just 5 minutes to activate.
This is an area where the major tech companies have done incredible work for the senior community. These onboard tools are powerful, they process incredibly quickly, and they are completely free.
Let's look at the iPhone first. If you have an iPhone, simply go to your Settings app, tap on Accessibility, and look for Hearing Devices. This is the central hub where you can pair compatible Bluetooth hearing aids directly to your phone.
Very easy to find.
While you are in that accessibility menu, you can also go to Subtitles and Captioning to ensure subtitles are on by default for video content. But the real standout is Apple's Live Captions feature. It uses the phone's internal processor to transcribe real-world spoken conversations in real time right on your screen.
And because it uses on-device machine learning rather than sending the audio to the cloud, it is very fast and it protects your privacy. It is incredibly useful in a loud environment or, say, at a doctor's office when you want to be absolutely sure you are reading and catching every complex medical term the doctor is saying.
And Android users have equivalents that are just as robust. On an Android phone, you go to Settings, then Accessibility, and select Hearing Enhancements. Google has a dedicated feature called Live Transcribe. It is remarkably accurate, entirely free, and turns spoken words into text instantly.
A fantastic tool.
Also, if you happen to be using a newer device, the senior techie notes that the Samsung Galaxy S25 natively supports that new LE Audio Bluetooth standard we discussed earlier.
Having that LE audio support built into the phone means your battery will last much longer when streaming phone calls or audiobooks directly to your compatible hearing aids. It is amazing how much processing power we carry in our pockets.
It really is. We have gone over a mountain of technical information and options today. So let's do a quick, actionable recap of the steps you can take today to take control of your hearing health. Number 1, grab your smartphone and download the free Mimi app, or WHO Ears if you are on Android, to establish a baseline of your hearing at home.
A great first step.
Number 2, if your results show mild to moderate loss, explore the capability tiers of over-the-counter options at mdhearingaid.com. Or if you want that in-person professional fitting with real ear measurements, visit your local Costco hearing center to look at their premium prescription models.
And enjoy that 65% savings.
Absolutely. Number 3, open your smartphone's settings, go to Accessibility, and turn on those incredible free features like live transcription and hearing device support. And number 4, if the TV volume is a daily struggle, look into an RF wireless headphone system or a localized near-ear TV speaker to reclaim the living room.
Taking that very first step of acknowledging the hearing loss is always the hardest part. But as we've seen today, the solutions do not have to be prohibitively expensive, and they do not have to be complicated. And I want to leave you with this final thought to mull over. When we utilize this technology to treat hearing loss, we aren't just amplifying sound. We are preserving our vital connection to the people we love, and we are actively protecting our cognitive health for the decades to come. Ask yourself, what conversation have you been missing out on that you could reclaim tomorrow?
That is beautifully said and a perfect place to wrap up our discussion. This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to keep up with our newsletters, you can subscribe for free by going to subscribe.theseniortechie.com.